about mental health. So just talking about mental health in the African context, in churches, nobody wants to talk about it. They only want to talk about it when it's the hot topic, when it's topical. Blood, is that just the question? I don't get it.
I don't know. No, listen. And also,
when Jesus was healing people back in the day, thank God for that. We are very grateful for the way he healed people. But are you happy that now we're waiting for his return to just chill and don't use any penicillin? When you're ill, just chill.
Is it the DSM?
No,
which one?
It's SRIs.
That's the one. The one that's changing every year.
Oh, you're talking about the diagnostics criteria. Okay.
Yeah, it's
DSM. Yeah.
Oh, it says DSM. Oh, yeah.
And there's ICD. But
Yeah.
That one.
Try to get you there.
I don't know. We need people like you to teach this stuff with grace.
We do try.
We do
actually.
You don't want to hear it.
But
you can't say you lot.
And the reason that I say that.
That's quite dismissive though.
Yeah, no.
That is very.
So let me
That's what I'm
land.
saying. So are we gonna do the issue when you're
let me land.
How are you gonna do it?
Let me
You're already
land.
dismissing them.
Let me
Wait. That's what
It's not as sensitive as you should
you're
be.
basically saying you're idiots. You don't want to listen.
Welcome back, guys, to Sound Words. Today we're looking at something really interesting, but something we've got to be really sensitive about. We're looking at mental health. Is it a demon or an actual illness? So I've got three amazing people who are going to talk to us about this topic. Introduce yourselves.
Hello, my name is Taiwo.
My name is Chrissy.
My name is Yvonne.
Praise God. Thank you. And I think before we move on with the topic, we want to say that we on this particular show we want to explore. We also want to address. So we want to really see what mental health is, look into it, look at particular things in it, but also we want to address it as well. So we pray that as you go on this journey with us, that we get it right, but you also follow us, and that God will take full control in Jesus' name. What is mental health?
So mental health is more than just a thing. There isn't a disease called mental health. It is a plethora of different diseases. So it's a fallacy to say that you have mental health. There are mental health problems and there are mental health diseases. So I think you have to unpack what that means when you ask what mental health is.
Okay.
Yeah, I would also add to that and say, like, just as you said, comparing mental health to physical health. Like when someone has a cold, you don't give them a different name. You don't say like, oh my God, you have cancer. Oh my God, you're terminally unwell. Do you see what I mean? It can be like you go through something difficult in your life and you're depressed for a while. Do you have clinical depression? No.
Absolutely.
Right? But obviously something has happened that's affected your mental health. But it's not the same as saying like, I have depression. I'm clinically depressed. Everybody has mental health, as she said, just like we have physical health.
So do they have depression or are they in depression?
It's a spectrum.
Yes.
No, but she just said depression as well.
Yeah, but she also mentioned depressive episodes. So it's a spectrum. So for example, there are lots of reasons why people go into depressive episodes, which may lead into depression. Good example.
What's a depressive episode?
So a good example is you lost somebody that you love, or you lost a job. The period after that is a depressed episode. In fact, it's actually terminally like a stress reaction. And sometimes you can have a bereavement reaction which is abnormal and goes on longer than it should. Can lead into a depressive episode. But that person may have some clinical signs of depression at the time, but it is not pervasive, so it doesn't continue. And that is just an episode. So lots of people will experience them. Whether in kingdom or Christendom or outside of Christendom, you're a human being and you respond to emotions. So you can have a depressed episode but still not be depressed or have that box over your head or title over your head that you have depression.
Yeah. So do you think that we in society we're struggling with a lot of stigmas, with the idea of you are now a depressed person as opposed to this is something that people are going through. It's a process. There's a journey, and people sometimes can come into it and then out of it. And it's not like we can't stigmatize or make conclusive statements about people being depressed.
I wonder why, especially in Christendom, we find it so difficult to understand that people can be depressed. Like, we also go through. Everybody goes through something hard. Something your body, your mind, you're gonna react to certain things. Like you have a breakup, you thought you were gonna marry someone, and you find out that they're a completely different. Like, how do you expect not to react to those things? And I don't know why we think of it as weakness to be depressed. Why is that a weak thing?
I think I know the answer to that question. I think from my point of view, from my experience, I think it's not the fact that I don't believe people can react. I just think that reaction was depression.
So the thing is, you mentioned stigma. Yeah. Stigma. You think that there's a stigma attached to it? I don't think there is anymore. Personally, I don't. As a GP, the number of people I see depressed a day is quite common.
So probably, I don't know what it is then.
So wait, I'll get to it. But what I say to you is that the world doesn't see it as a stigma. The church does.
Oh yeah, that's what
the world doesn't see it as a stigma.
The black church,
it's much more common in the world for people to say. In fact, they're more open to say, "I'm feeling depressed," or they would come to you and discuss symptoms of depression. They're more open to do that. The church, it is an actual battle for people to come out and say that they are going through something, because as believers we feel that, and I trust God, that God should get us through it. God will get you through it, but actually there are some times where you actually need additional help. So depression is not only a physical response to mental stress, it's also a chemical imbalance. So we're talking about depression as one part. Mental health illnesses consist of various other conditions, schizoaffective disorders, bipolar disorders. They all have
those are more. So there's something called common mental health disorders, and depression, anxiety, and OCD are one of them. Everybody has.
And what was the last one?
OCD. Okay. So like, for example, sometimes some people they have a thing about switches. Like all the switches have to be off. Do you know what I mean? You're not gonna say that person's mad. It's just something that people do. People have them all the time.
I would never thought that was a mental health thing.
But mental health is on a spectrum. Exactly. So why is it such a big deal?
That's because things like OCDs are very much on a spectrum. So people have common things that they would do, you would call a preference, which are slightly compulsive in their actions. But then there is OCD, which becomes really oppressive on that person's life, and actually they need treatment. And that falls under mental health problems.
So if you think about mental health, you think about how are you able to function in your everyday life, right? If you get to the point where you're depressed and it affects your ability to go to work, to interact with people, to maintain your relationships, to eat, to do normal things, to sleep, then you need more help. That's
to me, I think this is where, because I think in the same vein where we have people who are ignorant towards the whole idea of mental health and depression, not idea, that trivializes it, but you know what I mean. I think on the other hand, you've got people who know about it, who are also ignorant about what we don't know. So for example, I wouldn't have called what you're calling depression. So someone that doesn't want to go to work because they're having some issues or whatever it might be, I would see that as depression. But somebody feeling down, I wouldn't see that as depressed.
But that's the difference. There's clinical depression. That's like terminal. That's you need help and you need help constantly for the rest of your life maybe. When you're depressed, for somebody in your family died, you're going to be, do you want to eat? Some people react to it differently. Maybe you're not going to eat for a couple of days. And maybe if it's for a week, you're not going to go to work. You're not going to do... That person is depressed, but they don't... Do they... What?
No. I'll jump in when you finish.
But you're not going to... Why do we stigmatise people for needing extra help? Or what is so wrong in being depressed? Why can't I just say, you know what? It's one of those days I feel depressed today.
I don't know. No.
I think the thing is, I can already see that. You know the reason why you reacted like that? Because you don't want to accept it, and I completely understand.
It's not that I don't want to accept it.
No, but I can understand.
Why is that stigma?
But no, hold on. But why?
Let me jump in.
Go.
I think I can answer the question you're trying to ask here. Like, these two ladies have offered it from a very technology.
They know what they're talking about.
They know what they're talking about. Now, we got to bring it to scripture. Do you know what I'm saying? And I think a lot of people, they don't see it in scripture.
They do. It's there though.
That's the thing.
Elijah was depressed.
David, Jonah, Paul.
Even if you look at there was a I don't know if I
Jesus.
Jesus is a classic.
Hello,
let me
right before he was going to cross.
Wait, now in the Garden of Gethsemane,
he was anxious.
Tears of blood. Is that
the
depression? I don't get it.
I don't know.
No, listen. And also, like, rightly, like they've said, it is in the Bible, and most people are not told that it is.
Elijah was definitely depressed at that point.
Oh, so only Elijah.
The classic one is
no. I believe it.
Jonah wanted to kill himself.
I think what people do. I'm gonna let you speak, bro. I think what people do. I get your point. I get your point. Yeah. But I think what people do, I think we try and put so many, I think there's an umbrella of depression, but I think people want to put so many things in there to justify.
But you know the thing is,
to justify other things. And I think so. If you're feeling bad, if you wake up in the morning you're feeling bad,
okay,
bro, we have to encourage ourselves. No,
but
wait. I'm not ridiculing. I'm not trivializing. I'm not trivializing that there are some serious issues that are.
No. Nobody is saying that there's a cop out. I wake up today and I feel depressed, but guess what? I still have to go to work. But my job is not to say, okay, I feel depressed, so I'm not going to do anything.
I don't think I'm depressed.
That's not. But
I don't think that's depression.
But that's what we're saying. There's being depressed and there's clinical depression, and they're not.
And
the
this
same
is what
thing.
I'm trying to say.
Everybody has feelings of depression. If I wake up one day and I don't feel like going out to work, it's not my job to say I'm not going to go to work. It's my job to say why am I feeling like this? First of all,
I think depressed people won't even go to
Okay, but
step out the house.
let me tell you something. You're right, but you know what? There are clinical features and diagnostic features of depression. So all that is being said, yes, you can have depressive symptoms, but you are not clinically depressed.
That's my point.
That's what
So people can't say that I'm depressed.
If someone I can tell you. If you come and sit in front of me when you come to the surgery and say, look, for the last 6 months, I've been finding I'm not myself. I cry all the time. I don't know why I'm crying all the time. I don't feel like going out. All the things I love doing, I don't want to do them anymore. I can't sleep. Or if I do sleep, all my sleep is broken, or I wake up really early in the morning, I can't eat, or you're overeating. There are actual tick boxes. So if somebody fulfills those criteria and it is a pervasive symptom, that person
she says something
clinically
and
depressed.
that's for 6 months. But there can be a week where you're feeling that, and then the next week it's not like that.
And
you might not have clinical depression, but you're still depressed at that point in time. So my job is to why am I feeling like this? Is there something in my life that's happened? Yeah, so it doesn't mean that because I'm depressed, I'm not going to go to work.
It might be a response to an episode, something happened.
You had an argument with someone, you broke, I don't know, whatever it could be. Or maybe there's stress at work and you don't realise how much it's affecting you, right? And then you wake up one day and you're like, actually, why am I feeling like this? Is it because of this? Why am I feeling like this about going to
Can I throw a spanner in the works, yeah? Because I think we've talked about...
Uncle's point is still there, but...
Okay.
Let me hear the spanner.
Let's throw the spanner, because we talked about, stigma in the world or stigma, in the church. There is a stigma, but I think the stigma we're probably talking about is the black church.
Yeah, I was going to say
I don't think we're talking about the white church.
Nope.
And I'll tell you why. And I don't like to differentiate the church like that, but because of the cultural context in which a lot of us come from the Afro-Caribbean kind of background, if you go to the African and Caribbean countries, please believe there are mental health problems, very serious ones.
Yeah, I agree.
But unfortunately, what happens is the struggles that people go through in their day-to-day life, they cannot recognize that they are depressed. And unfortunately, there's no time to say you are depressed. Doesn't mean they're not depressed.
Yeah.
It just means that there is just not that focus because people are struggling for their day-to-day life. So that mentality follows us into the church and then follows us wherever we go. And that means that it's here.
Yeah, and I also think because you see in the Western world a lot of people say that they're depressed. For some reason, that makes people think that it's not as serious as it is. Like it trivializes it because a lot of people have the same experiences. Therefore, like how can all of you be depressed? It's not that it can't be that big of a deal. But that shouldn't be the way that it is. Just because a lot of people, this is what people don't realize. Just because something is common and it happens a lot, it doesn't mean that it's normal, and it doesn't take away from the fact that it's still serious.
True.
Yeah.
You don't say that about people who have terminal illnesses like diabetes, for example, right? And so someone comes to church, are you going to tell them to pray away the diabetes? Are you going to tell them to pray and take their insulin? You're going to do both. So why is it so hard for us to say, you know what, let's pray about this thing that you're going through, but go and see a counsellor.
And you know what, I
Go
can't
and see
pretend
someone.
that's the kind of advice that you can give to patients that look, medication has a role in treatment of clinical depression, but counselling has a role too. That counselling is mostly in the form of cognitive behavioural therapy where you rework how you think. So like anxiety that keeps going around in a spiral, you can break it. But sometimes that anxiety should also be focused at, spiritual, because sometimes some of the spiritual concerns that somebody might be going with will also make their depression worse. So I've had patients with me who, if it is appropriate, I will discuss with them what context of what spiritual context are you from. Maybe you want to consider having some counselling in that setting. And actually, those are some things that we can offer as Christians, and not feel that they need to tell them, oh, get off your medication. Because sometimes people do not help patients by telling them, just stop your medication. When they now go into an episode, which is worse than what they came from, what do you say?
But wait. See, that's what I wanted to jump on. Yeah, you see the old medication thing, yeah? Because I feel like, is it the DSM?
No,
Which one?
It's SRIs.
That's the one. The one that's changing every year.
Oh, you're talking about the
diagnostics
criteria. Okay,
Yeah, it is
DSM. Yeah.
Oh, so it's DSM. Oh, yeah.
And
so
there's ICD, but
Yeah.
that one.
We
That's
Try to get you there. Yeah, Mikey.
Wait, you know what you're about to say.
I'm trying to get you there. Yeah, I got you.
Let me shove it. So, is it like, because what you're saying is very right, very, very correct. And but my problem that I find is, what in my research what I was understanding is, it's easier to get on medication, it's harder to get off it. Why is that? What?
See, the thing is with that is that with medication, you need to have a target in mind. So when I see patients and it's clear that they're going through an episode which requires treatment, so not every person that I see who is having episodes of depression or clinically depressed requires medication. Some of those people, they need intensive counselling. But in occasions where, okay, I think this person is appropriate to start medication, we will start it, we will review it. Initially, we review it in the first 4 to 6 weeks. Then we review it in another 3 to 4 months. And actually, then we take time to see, are things improving? And in most cases, that person who's on medication should also be having some kind of talking therapy, because that medication is the ladder to help them to get over what's happening, but it is not it doesn't take them out of it. Do you understand?
And a lot of people stop taking their medication on their own volition. If you're going to be off antipsychotic medication, it needs to be graded and gradual.
And we can wean that off.
That.
And actually, it's something that we encourage to do if it's appropriate.
And you know what? The reason I bring that up is because some of the argument is that it's become a thing where now
we just want to put everybody on antidepressants. No, it's
not even that. It's become a money conversation now. Do you know what I mean? Because the drugs are selling, and there's new drugs that's coming out every day. Like, people are being, not only do you have this, you also have this, you also have that, you also have this, and then before you know it, you've gone in for maybe depression, and now you're taking like 6, 7
But
months.
Trust me, I don't think any it's looking to give people diagnosis, you know, because it doesn't benefit me. I don't go home and say, I made this today.
For a lot of people, rarely you see people that only have depression.
Most people have anxiety and depression.
Exactly.
3% of people in the UK. 3% of people in the UK suffer with anxiety and depression.
The difference between the two, which is why a lot of people share it. Do you see what I mean? It's very different sometimes to distinguish and differentiate between the two, but there's common features of both that you see in someone, and so you need to treat both. You can't just treat one. Do you see what I mean? So what you're saying about someone going in for one thing and coming out with the other thing, that's rarely the case. Maybe it just came to light that actually this is something else that they were struggling with. And medication isn't just given out. Like, I mean, why is it okay to have different types of paracetamol?
Come and be begging for antibiotics, but you won't take.
I don't get it. Why
medication?
Why can't there be a variety?
Because you can stop taking paracetamol once the headache is gone.
Yeah, it's true.
Now,
but the thing is,
you just said something interesting. You have to review them.
But that's the thing.
So they couldn't just say, do you know
what?
what? Actually, I'm feeling better today.
But the thing is, it can go. People have the idea that, okay, after 2 weeks, my depression should be over. Okay, but what if it's not? And that's the thing. With a clinical depressive episode, it doesn't just go in 2 weeks or it's gone after a prescription of 1 month. You need to review it the same way your mental health. But I'm saying, but the same way your physical health needs to be reviewed. So, for example, with diabetics, do you know that a diabetic can eventually come off the medication? A type 2 diabetic. A type 2 diabetic can eventually come off their medication with tight control. With tight control and regular reviews, we can possibly, obviously, with them making lifestyle changes, including weight loss and exercise, we can actually eventually take them off their medication. But that is the same way that we would have to tightly manage and review a patient with depression. It has to be done with responsive, regular reviews. But if the patient just says, I'm going to take my tablets and that's the end of it, unfortunately, that's what will happen. They'll just stay on the tablets. They won't really get reviewed. Do
you know what I think could be done, yeah? Do you know, I can't talk against your profession, because you guys are very well sounded in it. But by the sound of it, yeah, I think we need to get more of this in the churches.
Yeah. You know they're there, you lot don't want to listen.
No, but but this is what I'm saying. No, wait, sorry. So you say something interesting, because you know what it is, yeah? Obviously, both of you are very passionate about this particular topic.
I'm rightly so, by the way.
But you got to understand, yeah, it's about the delivery as well. Do you know what I'm saying? Because I can understand you've seen X amount of people. There's certain things that someone will come to you, the fact that them saying it, you're getting annoyed already because it's something that is so common. Do you know what I'm saying? Like something that can easily be fixed. So you might not have the same tolerance as somebody that is just airing it for the first time, you know. So I would probably say, yeah, like with the black church or the Afro-Caribbean church or whatever, yeah, we need people like you to teach this stuff
But
with grace.
We do try.
With grace.
We do actually.
You
attempt
don't
to
want to
do
hear
grace.
it.
But
That's
it's
you can't
difficult.
say you
This is
lot.
what, no, but this is what I'm saying. Like,
This is what I'm
I
saying.
won't say you lot, but I say the cultural context makes it very, very difficult. Because if you don't understand what you're talking about, you have to first get people to a level of understanding,
Okay,
and that is what is
100%.
difficult. Good example. We're talking about depression, but let me give you a good example. Schizophrenia is a big issue in the Afro-Caribbean community. I remember very vividly learning in medical school that there was increased prevalence of schizophrenia and mental health problems in Afro-Caribbeans, and I sat there, I said, why? And actually we had a very good explanation. So in the UK, when people were brought over from various parts of the world, they were alienated, and things that they were normal to them were seen to be abnormal to the people around them. So then they start to respond in a way that was, abnormal. Some of those things were not abnormal, they were just doing the things that were normal in their context, but it was deemed abnormal. And unfortunately those kind of things bred mental health problems like schizophrenia. It is not only that, okay, so that's just one part of it. That is not the reason for schizophrenia. But I use that example to say that in some countries, mostly in the African kind of context, people with schizophrenia are looked at as demon possessed, or they're not well. Yeah, and unfortunately for them, I'm telling you from a personal point of view, unfortunately for them, those people are not given the treatment that they deserve and need. So for example, depot injection in this country, someone is floridly psychotic will be given medication to make sure that they are staying well, because when they feel like they're fine, they stop taking the medication. You understand? So they give them a depot medication which will last for a long time and make sure they regularly have it. Somebody will review them, make sure that if they're not well, they'll be taken into hospital. When you don't have that setup, that structure, that infrastructure, then how can you explain that? And people bring that here and they still don't understand it. And this is what we're saying, that if I try and explain, how to treat somebody, people don't understand it.
You don't want to hear it. And the reason that I say that,
that's quite dismissive though.
Yeah, no.
That is very.
So let me
That's what I'm
land.
saying. So are we gonna deal with the issue when you're
let me land.
How are you gonna deal with
Let
it?
me
You're already
land.
dismissing them.
Let me
Wait.
That's not as
You're basically
sensitive as you
saying
should
you're
be.
basically saying you're idiots. You don't want to listen.
No.
Why should I even bother
Wait.
talking to you?
No,
Do you know what I'm
that's not
saying?
true.
Now you
No,
may
no,
lie.
that's not
true.
Now you may lie.
That's not true. So obviously I have empathy for people that I'm actually dealing with and speaking to. But the reason why sometimes for our church that I lack empathy is because when you want to have these conversations with people, they look at you like, why does she want to tell me I'm mad? Why is this girl talking to me? That's why I say no, because to be able to talk about, no, I'm not talking about sick people. See, we're talking about mental health. So just talking about mental health in the African context, in churches, nobody wants to talk about it. They only want to talk about it when it's the hot topic, when it's topical. But if I'm asking you, how are you feeling today? This girl wants to come out and tell me, especially knowing what I do, that knowing that I'm a therapist, that I deal with people who have severe, they don't want to hear it.
They don't want to be.
That's why I said. And also, yes, exactly. So that's why I said you don't want. No, I'm saying that there's steps that we're taking towards that. Yes, we're having this conversation, and that's one of the things. But why are we not having this conversation in the church right now? Why?
We are the church.
Yeah, we are the church, but that's my point. When I say that we don't want to hear
I
it,
think some churches are trying, but it's
my
not
church brought some people.
Why don't you just give somebody who deals in this stuff the mic and let them do a sermon? They will not do. So then when I say
Yeah,
that
but
it
I
always
don't
has to
think
be.
you can make a sermon on this thing alone now.
No, of course you can. You can open your Bible and make a sermon on it. There's
So
so
who were
many
the people in the Bible that had mental health issues?
David,
Jonah.
When was David?
They say Jesus.
open the Psalms.
I
I'm just trying to.
What do you mean? Apparently, his child died.
His child
You know
died.
what, man?
But didn't he say bring me food after his son died?
That was because God said it's time to get up, and he did. But that doesn't mean he wasn't having a
So
depressive
what was your proof that
episode.
he was depressed?
Yeah? It's not depressive
He was telling
Hold on a minute. I think this is what he's saying.
No.
This is what. Hold on a second.
go.
This is what he's saying. You see, you two have come. You guys are aficionados in this topic.
Very intellectual.
You
very
guys know what you're
articulate.
talking
It
about.
doesn't mean
Now-
that he
And
likes
that might be the reason why they don't want to hear you in the church.
Now we need to find a way.
The way you jumped on me. The way you jumped on me. I don't want to talk to That's the family tree. What I'm saying is to use this. For us and the people that are listening, like you said, like you rightly said, and I fully agree with what you're saying. I think your passion is admirable. I think it's amazing. But what I'm saying is though, for some people that are listening, this whole mental health, depression thing is something they've been so foreign to. It's so strange to them that the understanding of it is very elementary.
So it's not necessarily. So I'm not saying.
No, but what I'm saying is, if you're saying that David was depressed, I want you to show me where he was depressed in scripture.
When his child died.
Okay, I want to see, but where? Because obviously it doesn't say he was depressed. Obviously,
Exactly.
So I'm saying, I want you to show me the nuances. Where the nuances? Where the nuances of where?
Let me ask you something. Say something quick.
Can I say something?
No,
Even
how
Jesus in the garden, he was crying tears of blood. Do you want to tell me that that's not... So, listen, you also have to understand, I know for a lot of people who are very conservative as well, when you read the Bible, because it doesn't use this terminology,
of course.
it can be very difficult for people to understand. But what we have to take a step back and understand...
I think Elijah was clearly depressed.
Yes, but the thing is, the Bible was written in a time when people didn't have the kind of illumination we had now. Right? Even epilepsy back then, it wasn't... When you read it in your Bible, when that person was having a fit, right, they were demon-possessed, and the legion came out of them, right? That was an epileptic fit, but they didn't describe it as that back in that day.
So that means you're saying that mental health is demonic then?
No. That's
you
not what I'm
just said
saying.
that epileptic fit is from
No, I'm using an example to say. I'm talking about terminology.
Just to mention that
I'm not talking about any demon. I'm saying
demon possession. Those people were not believers. Any person that was demon possessed were never believers.
But what I'm talking about is...
But
what I'm talking about...
Wait. Everybody that had demon possession was having a mental health problem.
What I am saying is that the terminology... What I'm saying is that the terminology that we use to describe things that we see in the Bible now is different because we have a different level of illumination.
So they did. Broken-hearted, downhearted spirit.
Right.
Those kind of things, troubled, overwhelmed.
Illumination that we have technology, we have... Do you see what I mean? That's my point. That's why it can be difficult for people
that's a semantic language thing.
Yeah. So, but I'm saying you have to understand that when you're reading the Bible, because it can be difficult otherwise to then try and understand the experiences of people back in those times. Because even the language that they use is not the language that we would commonly use to describe our experiences.
But you know what? That brings up a different question.
So that's why when I'm reading the Bible now with the illumination I have, and I'm seeing Jesus in the garden, I'm like, oh, Jesus.
Okay, Ivan.
Would you not be depressed? You're going to die across the next day.
So wait,
I don't get it.
Do you know, Asia? I completely agree with the whole, like, there are some people in the Bible that's got depression and that stuff, Now, when I was doing the research, I'm reading that stuff, I get it. I get all of that stuff, but they still went on to do stuff. They still went on to, like, go about their business. Now, you say they don't have the illumination that we have now, blah, blah, blah. They also didn't have the medicine that we have now. So you know what I'm saying? So how is it that they were able to get through their episodes with less or practically nothing, and we can't seem to now go about like without being put, like you said, being put on medication, being reviewed. But even the women that had the issue of blood, right? Yeah. Right now, if you came now in 2016, you wouldn't tell her that she should only go to church. You would say that she needs to go and get a hysterectomy. Do you see what I'm saying? Like, so there's differences. There are so many things medically in terms of how we deal with them now.
When Jesus was healing people back in the day, thank God for that. We are very grateful for the way he healed people. But are you happy that now Jesus we're waiting for his return to just chill and don't use any penicillin? When you're ill, just chill. And also, that's why God gave the wisdom for these things. God gave us these wisdom things. Exactly. We're not supposed to just pat our nose down it and say, oh, because we're believers, we don't need any of them.
There's a reason that there's doctors today. All knowledge comes from Christ. The fact that we even have this knowledge about these topics is because Christ wanted us to. This is how he expected for humanity, for his creations to progress. The Bible says a lack of knowledge makes the people, I'm paraphrasing it. You know what I'm saying, right? My people perish for lack of knowledge. It's one of my favourite scriptures because and knowledge is ever increasing. God is the only one who knows everything. We are the ones.
Nothing is new under the sun.
We are the ones perpetually playing catch up. Even in those Bible times, all they had was Christ. So that's all they had. Now we have more. We have more things that can give us.
But we still have Christ.
We still have Christ, right? But these things have been given to us to aid us. They're not in opposition with the church. They're not in opposition with Christ. Medicine is not opposing God.
With science.
So you're saying conclusively, in its entirety, you're saying that mental health has nothing to do with demons.
No, let me be honest with you. I believe that there are mental health problems that are physical, that are due to lack of various things like proteins or lack of hormones in the body, and those things are replaced with medication and help to stabilize. However, I cannot lie to you that there is not demonic influence Okay, no, rather than demonic
That sounds like a nice way to get out of it.
No,
Is it demonic or not? Demonic influence or demonic thinking?
it's not a nice way. I'm going to give you a good example. When I was in medical school, we did a psychiatric placement, and I remember having this kind of debate in my mind as a believer and also coming to see psychiatric patients. I remember thinking, well, okay, there's a patient sitting in front of me and she says she believes in Jesus and he's a Lord and Savior. I'm sitting here, I'm not in a psychiatric hospital, I believe the same thing. So I asked my consultant, who is not a believer, I said, well, why is what she's saying wrong when other people believe the same thing as I do? She said, it is the degree by which she has gone so far left. So for example, before she was in hospital and before she was deemed to be unwell, these were commonly held beliefs. But then she started to have manifestations which are not normal and they are not in context with her belief. Do you understand that? So they were completely out of context with the belief that she has. So the belief system is not the same as what she's also expressing. So she'll do things that, or say things that a believer wouldn't agree with. Okay?
But they do that all the time in the Christian church. They do.
In the psychiatric way, no. Because the other thing I was going to mention was that when I met this patient, I also got the vibe that this was not more than just a medical problem with her. That there was definitely some kind of oppression that was going on as well. And I can't lie to you as a Christian and as a doctor and say here, categorically, there is no demonic influence. As believers, the Bible tells us that no one can snatch us. God says no one can snatch us out of his hand. But we can open ourselves up to things that are not of God. And I think that's when I say things like influence, that's what I mean. We can open ourselves up to, that's my belief as a Christian and as a doctor.
I don't, so, that's Dominic thing. I don't believe that mental illness is demonic. And the reason that I will say that is because of various reasons. Number one, especially as a Christian, when you have Christ in you, you can't. How can a demon come?
And that's what I'm saying. I'm not saying mental health is. I'm not saying mental health problems are demonic. I'm not saying that they are demonic.
So Christ dwells in you. How can you have a demon dwell where Christ dwells? It's not possible. That's one. Number two, when we talk about when we talk about the brain, right? Because all of these things, they stem in the brain. Remember that all the things that we know now about how the brain works, neurotransmitters, chemicals, physiology, they didn't have that knowledge back then. Okay?
We're still learning.
So we're still learning it. So when I read scriptures that say, do not worry, with the knowledge I have now, I understand, because what worry does to your brain perpetually, it damages, so down to the chemicals in your brain, stress, right? The chemicals that stress released in your body are so bad for your brain. They're not supposed to be there all the time. Stress is supposed to be a reaction to like a life or death situation only. That's it, right? But the times that we live in now, our lives are highly stressful, work, bills, all of these things. So we're experiencing these emotions and which lead to the chemicals being released more often, right? That's something that they didn't have knowledge about before. So when I'm thinking also about how God created us and how he created our brain to work optimally, when he says don't worry, it's because worry, right, doesn't allow the brain to function in the way God designed for it.
So you're saying that it's not demonic, there are just other things that we're not doing that's adding to it?
Not necessarily that we're not doing.
That worrying
so do you know what it is? It's a consequence of sin, right?
Yes.
Sin entered the world, which is why now we have bad things happening, blah, blah. So when you think about that, there are things that happen that are uncontrollable. So because of that, there will still be stress. Whether we like it or not, we're all going to experience stress because sin is in the world. There's stress somehow, right? So for some people, they go through things in their household. When we say it's demonic, I feel like it really trivializes people's experiences. But some people have experienced abuse, rape, trauma. They've been beaten. How would you expect?
On that point,
and that's for a weight, and that's a lot.
I like you made the point.
And when she says demonic influence, now that is a consequence of sin. The fact that you're in a world where there's abuse is a consequence of sin.
My issue, and I feel like you're right, because we cannot trivialize the fact that there are some people who have gone through things.
Most people,
and we're talking
especially
about
in our community.
We're talking about serious things, like you alluded to some real serious things, and I think that we as a church and as people need to be really, really serious about that. We can't sit there and just talk about it like it's just a thing. It's people's experience, people's life, and I think we should respect that. My issue is with that we have, and I think some people in the profession, like yourselves, and other people are so quick to find other things that I don't think are in that category. And I think in that category of those serious things that people have gone through, that they're going through serious situations.
It doesn't fit.
It doesn't. I don't think it fits.
Yeah,
and then what happens? What happens? It trivializes the whole thing because then I look at her. They're calling her depressed, and I think she just got to get up. And I think, and I look at that person.
No,
that's
I
a
can explain
genuine.
that. No, I can
to get
explain
my
that.
point.
Can I explain that? So we're talking about sin entered the world. That's why we have disease, we have HIV, all of these things. Everything's imperfect. Blah 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 blah. Right? With that comes the fact that even the fact that there's genetic influences in your family. You don't know. Some people are just predisposed to certain things. It's nobody's fault. It's as a result of how humanity has evolved, right? So for one person, they can go through the same thing and they don't end up depressed. For another person, they can go through the same thing and they will be depressed because that is just how they are predisposed. And these are things that you don't find out about yourself until shit happens.
I don't agree. I don't agree.
I don't agree.
I'll tell you why I don't agree.
No,
because you're talking about nature versus nurture, and it's not the same thing. So if you are living in an environment where, and it's clearly seen all the time, where you have a neurotic parent and every small thing is a major problem, and that means they're going to die. They're going to. That will raise a neurotic child.
Yeah, of course.
But that is not genetic.
I'm not saying that is genetic.
That is, they are more likely to have.
I said
more
predisposition. I didn't say where the predisposition comes from. I said predisposition.
That is more
so
of a nurture issue.
No, but predisposition can be from.
Tell me if I'm ignorant here.
Nature or from nature.
Tell me if I'm ignorant here. I get it, and I fully get it, and obviously in the role that I play in my profession, it would be so wrong of me to think to have an ignorant mind towards this, and I don't. And I sit there and I see people, young people, parents, man, said there are mental health issues there, and I'm nowhere going to trivialize it. We've got to deal with it. But I sometimes think about people in other parts of the world, where our poverty can sometimes be their affluence.
Exactly. Trust me.
And I can't, and I don't, again, in the exertion not to trivialize it, and make it all about money, I just somehow can't say how the same human being can be depressed in that situation.
Do you know those people who travel from, I've met so many people, right? First of all, I used to work, let me give some context. I used to work, in a specialist eating disorder services for young people who have serious eating disorders. These are people who don't drink water. They haven't drank water for 2 years. Okay? And I also worked with people who had serious psychosis, long life. Do you know the most people that I met? They're people who traveled from back home and they came to this country. They came from poverty thinking that they're going to come here and because they have money, everything is fine. Guess what? They still have mental health problems.
Yeah, but that's not what we're talking about. That's not what we're saying.
No, that's not what I'm saying.
That's a true point.
Poverty and they still
I get your point. That's not what I'm saying, though. I get your point. That's a true point.
What you're saying is what I mentioned earlier. That the fact is that in this country, we're talking. It's relative. In the Western world, our form of poverty still means that you can find a roof over your head. Still means that if you really, really want help, they can give you help. The form of poverty in the third world is different. That's the reason why the things that we call trivial, that people end up with depression. They don't have that because their struggles are different. But that doesn't mean that they are not depressed.
Exactly.
It just means that their struggles are different. And that's what we're saying.
How you define depression also varies, right?
But that's why we have. That's the reason why we have a standard criteria by which we define depression, because you have to take depression out of its cultural context.
So what I'm getting from what you're saying, I get what you're saying. I think you're right that they come from another place and be depressed, because I get that. I think you're absolutely right. But that's what I'm saying.
Because that time when they move from that context, it's become almost
I get that. I think you're right. But I think what I'm getting from what you're saying is that based on where we've come from, people have different thresholds now.
Yeah, and that's the reason why you view it differently. Because when you come, so for example, I having come from the African background, I went to where I come from some many years ago and looked around and I was like, people are really suffering here.
You will start thanking God for your own.
And they're happy. They're suffering here and they're happy and they're making do with what they have. And people are not suffering back at home, but they think that they are.
Yeah.
And it's because you see the difference in inequality. It's
and that's what I think. What Taiwo was saying earlier. That's what I'm saying. And we've got to round up here. But that's what I'm saying in terms of the people that do your job. I find it. I don't know how you do it, because to me, I will see certain people, and what you're saying there, I get what you're saying. I'll think to myself, if I put this person in a different context or different situation, how are you depressed?
But the thing is,
but you know,
I get that, and I guess that's the education that needs to come from it. And do you know what the
problem is? We don't value our emotional health the same way we value our physical health.
Yeah.
Right? Because if you're
as a whole.
I think generally,
cool.
but I also think we Africans we glorify suffering a lot. Let's not even pretend. We really, it's like yes, I really do think that it's like if we can take all the suffering that life throws at us, we're so good. I get your point in the sense that we glory in. It's like we're strong. We can take everything that
not our generation though. Generation ahead of us.
Maybe not ahead of us. Not our generation.
Okay, guys.
But in general, that's why. You can see someone who looks physically like everything is fine and they have a roof over their head, but you still aren't able to see that there's value in the fact that they're struggling. There's still a struggle.
So if anything, what you mean to say is that actually, as an Afro-Caribbean society, we don't value our emotional health.
That's what I said.
That is what we don't value.
No, we don't value it. That's what I said.
We are interested
emotional health.
Sometimes we're interested in our physical health, but the emotional health part, it doesn't even come into view because that one.
Because there's no gym that can go and fix it for you. That's why.
Flex.
Do you know? We definitely have to do a part 2 and a part 3 and a part 4 possibly. I think that the overall message in this is that we believe that God can do all things. Yeah. And I think that's something we need to learn about. And I think what we've got from our sister and our brother here is that God cares about these things. And I think we need to remind ourselves, absolutely, He cares about all of our thoughts and all of and everything that goes through our mind. And I think that we need to remember that we can always go to Him, but also He has, like you rightly said, He has given wisdom to some people where we can go to them for counselling or therapy, whatever it might be. And I pray that you're blessed by that. Please leave your comments below because I would love to hear where you would like the conversation to go further. I'd also love to hear if you feel that we were wrong about anything as well, and we can address those things. God bless you and see you soon.
We need to be around fellow worshippers because we need encouragement. Iron sharpens iron. But at the same time, you can't say because you gather with people to praise God and worship and all that stuff that when you're by yourself that you shouldn't. As a matter of fact, when you're by yourself is when you should even more.
And so both of us are antagonizing each other, and then we get in a situation, somebody decides, I'm leaving church, that's it, boom, I'm gone. Do you know what I'm saying? But that's what I'm saying, that for the individual who's saying they don't want to go to church, it's fine, because when we say about church, my image always comes like, because anybody else is like, the building. Fine, if you want to stay at home, but just don't bring your own.
I don't even know if I should say this, but in one of the recent, well not so recent, but quite recent, in one of our local churches, where I think the apostle was, doing something with little boys. I think was touching up little boys. I'm sure the church knew about it eventually. And before the church took action, the government had to come in and take action. They had to lock this man up.
So you think that churches, when they're seeing some of these big issues happening, people know about it, but they don't say anything?
Usually, the last person to know about it would usually be the people that are close to you. But people do know about it.